Depression is a serious yet common form of mental illness that affects anyone at any age, even our athletes. Depression impacts the way they think, they feel, and the way they act on and off the court. Athletes suffering from depression, they may feel sad and lose interest in daily activities that they once enjoyed, and their performance will decline. If these issues or the situation is not addressed timely, it would make day-to-day activities more challenging and interfere with their practice, which will cause poor performance on the court. Do you have athletes that seem down and their performance has changed? This could be the first sign that something serious is going on, and it could be a sign of depression. I am Dr. Delise Coffey. I'm a psychologist and a mental game coach. As a psychologist, I put mental health first. I help my athletes return to mental wellness, and I help them stay mentally healthy. As a mental game coach, I teach them strategies and give them tools to get their mind and body in sync so they can have their best game more often than not. I've been working with basketball players for over 25 years. From junior high to semi-professional, at some point in time, I had athletes that were suffering with depression. Today, I would like to share with you some strategies to help your athlete overcome depression. In one of Paul George's games, the week before, he was kind of off in practice and wasn't having a good week. And then when he got to the game, his performance was not good at all. While the world thought that this was poor performance, he had a bad game, he later revealed he was depressed. Depression is common in athletes and the general population. It's critical to understand and recognize the signs to help our athletes and help them return to mental wellness as soon as possible. Some signs of depression that may hinder a player's performance are excessive fear, worrying about things beyond their control, low self-esteem, impaired concentration, changes in their sleep habits, changes in the appetite, a loss of interest in sports and leisure activities that they once enjoyed, and feeling sad and down more often than not, and that's just to name a few. In a research study conducted in 2019, it concluded that 21% of student athletes that were male and 28% of female student athletes reported feeling depressed in a year's time. 12% of college students athletes, they reported seriously thinking about suicide within a 12-month period. Another study showed that depression is among the top 3 mental problems along with anxiety and stress. In addition to student athletes, professional athletes struggle as well. Amanda Beard, an Olympic gold medalist in swimming. Ricky Williams, a former NFL athlete. Dante West, a former NBA player. Imante Boyet, another NBA player. And more recently, Simone Biles and Naomi Osaka. Athletes are usually reluctant to seek help from professionals because of various reasons. And some of it could be, it's a perception that it's a sign of weakness. That's a big one. And there could just be a lack of knowledge. They could not understand how beneficial therapy could be for them. And players may feel that it would affect their ability to stay on a team or it would affect their image. These are just a few of the reasons they're reluctant. Now, here are some strategies that you can give your athletes and share with your athletes to help them overcome the feeling of depression and the reluctance to seek help. Have them to talk to a family friend. Exercise daily. Do meditation. Question their thoughts. Make sure their thoughts are moving them forward and they're positive in a powerful way. Adjust the goals. Make sure the goals stretch you and not stress them. Get enough sleep. Yes, sleep is the one that's overlooked, but it is super important. If you have an athlete that's struggling with anything, or if they just need somebody to talk to, have them click that link above and connect with me. I will be more than happy to help them in any way that I can. And remember, physical is just part of it, and mental, that's the heart of it.